Good afternoon, everyone. My name is Nichelle Steenbeek. I'm the health promoter here at South Huron Hospital. With me is Dr. Ken Milne, the Chief of Staff. And today at South Huron, we're going to be talking to you a little bit about something we like to call choosing wisely. So, for those listeners, could you please explain what we mean by choosing wisely?
I'd be happy to. Choosing Wisely is a campaign that was started actually in the United States, and it was started under the philosophy that nowadays we are over-testing people and then over-treating them because we're doing so many tests. And some of those tests may not be necessary, and therefore some of the treatments may not be necessary. So what they've challenged other organizations to do is choose wisely. So before we do something on behalf of a patient, we should think about it and know, what's the evidence show? Should we really be doing this? Is there potential harm in doing this? And so what we're trying to do at South Huron is choose wisely and join in that sort of movement of putting our patients' needs first.
That's great. Thank you very much for explaining that. So that's great. I hear that South Huron Hospital is going to be known as the little hospital that does choose wisely. Can you tell me a little bit more about some of the things that we're going to be doing in practice to make sure that we make the best decisions for our patients and choose wisely?
Sure. The medical staff got together this fall and went through a list of suggestions on things that we could do to choose wisely on behalf of our patients. And we came up with a list, and we sort of narrowed it down because the challenge was 5 things. If we could find 5 things to do.
List.
Yeah.
Mm-hmm.
And so we did, and we came together and we got a list of sort of 5 things that we could do and agree on that it would be in the best interest of the patient to choose wisely on those 5 things.
Okay, perfect. So the first one I understand is having something to do with our previous infamous video on flu shots.
That's right.
Now this one's not as much to do with the public aspect of the flu shots, it's more to do with staff, as I understand. So what are we doing as a hospital to improve the immunization rates of staff?
So exactly right. The flu shot video was really, really well received. And so we're hoping to replicate that with today. And the very first thing we decided was, you know what? If patients are getting the flu shots, shouldn't the doctors get flu shots?
Makes sense.
And so all the what are called privileged medical staff, so the staff, so that does include nurse practitioners as well, all the privileged staff that have the privilege of working here have agreed that we would get the flu shot, or if we can't get the flu shot, because there are some reasons why people can't, we would wear a mask. And we all took an oath, at least all the physicians took an oath, and that oath was, first, we would do no harm. And I as a doctor, and I know my colleagues as a doctor, don't want to give our patients an infectious disease that could be prevented before it even starts. So we are going to choose wisely, we're going to roll up our sleeves, we're going to get a flu shot, and if you've gotten it, you get this fancy new badge, which I just got today, that says, the little hospital that does get their flu shot. So that's the first thing in the choose wisely part that we're doing.
That's great. The second aspect I understand has something to do with x-rays. Now, I understand we're going to be talking a little bit about using the Ottawa ankle and knee rules. Can you explain that a little bit to me?
That's correct. X-rays involve radiation, and radiation can be potentially harmful. So we want to limit the amount of x-rays people receive over time. And there was this really, really bright group in Ottawa, led by Dr. Ian Steele, who came up with the Ottawa ankle rules and the Ottawa knee rules.
Okay.
And they proved that if you twisted your ankle or twisted your knee, there were 5 things you could go through, the doctor could look at, and say, if all of these 5 things are fine, you don't even need
an x-ray.
Exactly.
Okay.
And so why x-ray sprained ankles if we know in advance, based on these 5 things, you don't need one. And then we can say, yeah, it's a bad sprain. We can do that with assurance that we're not missing broken bones. We wrap it up in a tensor bandage, treat it the typical way we treat a sprained ankle or sprained knee.
As long as you go through those 5 criteria.
As long as those things. And so we're going to limit the amount of x-ray radiation that patients at South Huron Hospital receive. And it's been shown in studies that if you do that, you do decrease the amount of x-rays that are done and you don't miss any broken bones. So if the doctor says to you, you don't need an x-ray, they've probably applied the Ottawa ankle or Ottawa knee rules and saved you some radiation without missing a broken bone.
Sounds like a decision that you're making wisely. All right, the third decision that you're going to make wisely, I understand, has to do with Bell's palsy. Now, what are we going to be doing about those patients with that?
So some listeners may not know what Bell's palsy is, but Bell's palsy is a paralysis or a facial droop, and it affects a number of people, and we see them in the emerge. Now, usually people come in going, oh my God, I've had a stroke, which is possible, but we assess them, and it was named after Dr. Bell, and it means that this one nerve in the face, we're not exactly sure, and I don't mean just we, I mean all the medical community doesn't know for sure what happens and causes this. But we do know that there's an effective treatment.
Okay, so what are we going to be doing for those patients?
So we'll give them
who do have that?
the thing that actually shortens how long they may have that droop on their face and hopefully prevent it from being permanent. But doctors in the past had tried antivirals because often we'll go, I wonder if there's a virus that caused this.
Right.
And they showed with Bell's palsy that if you give the steroid medicines, that helps. But if you give the antivirals, that didn't help.
Doesn't do anything?
So why give someone an expensive medication that has potential side effects?
Right.
So it's expensive, it has side effects, and it doesn't help the patient. So why do it? Now, the most famous person in Canada probably is our former Prime Minister,
Jean Chrétien.
Jean Chrétien. And he was one of the unfortunate ones because the usual thing to happen is that you completely resolve with Bell's palsy.
Right.
But he didn't. He didn't, and he was always left with a bit of a facial droop. But the Bell's palsy does affect the mouth, and so he's probably the most famous Canadian with that condition. If you come into the emergency department, we will do our best to give you the best possible care for Bell's palsy, but that doesn't include giving antivirals.
Okay.
So we've decided to choose wisely and not use a medicine that does not help.
All right, the fourth decision that we're
Are we
going
at
to be
4
talking
already?
about. We're doing great today.
I like doing these things with you. You're
That's
awesome at it.
That's great. We're going to be talking about abscesses. Now, what are we doing to deal with abscesses?
Okay, abscesses. Abscesses are referred to sometimes as boils. They're those large
It's a nice word for
things that people get under their arms, in their groin, and other places too. And they're very, very painful. And the solution, the treatment, is to release the infection, to cut the infection open and release it and flush it out. Sometimes, more often than not in the past, doctors had been using antibiotics. But there's been lots of information recently that says adding antibiotics for a simple cutaneous abscess. So a simple boil that's been lanced open, that the antibiotics didn't increase the cure rate.
Okay.
Didn't speed it up.
I didn't even know that. Okay.
Didn't cure it faster. And so again, we want to choose wisely. And we certainly don't want to give a medication that's going to cause potential side effects. And
Right.
we all know
Avoiding unnecessary
that
procedures.
antibiotics, if you give someone an antibiotic, they could potentially be allergic to it. They could get diarrhea. So now you have a boil, maybe in an uncomfortable spot,
Let's not think about the consequences.
going back and forth with diarrhea. As a woman, a yeast infection could be a result. So there are complications to a medication, and we accept sort of complications if there's benefit. But
Right.
if it's not going to benefit the patient at all,
Then we want to avoid
we
those
shouldn't be doing it,
unnecessary
right?
things. Right, makes sense.
Okay, so that's number 4.
Okay. Now we're going to be moving on to our last one, number 5, has to do with upper GI bleeds. Now, can you explain to me what that is and what we're going to be doing about it, just for others like me?
We left the hardest one to last, of course. So the 5th thing that the doctors have decided to choose wisely at the South Huron Hospital is that if someone comes in with a upper GI bleed, and GI means gastrointestinal. So basically we're talking about a stomach or up in the throat area called the esophagus. So in the esophagus or the stomach area. From time to time people can have an ulcer or a bleeding problem from that area. And again, the standard treatment in the past was to give the person something called a proton pump inhibitor. The name's not important. It's an acid suppressor.
Okay.
And it made sense thinking, oh, if I suppress the acid, it will bleed as much or have as much problems and stuff. Well, the research unfortunately showed that it really didn't have a great positive effect.
Okay.
It wasn't super beneficial for patients. It didn't prevent some of the major things that patients and doctors are worried about. In other words, does it prevent you from rebleeding? Does it cause less number of people to die? I mean, they're bleeding from their stomach area. Unfortunately,
it's a serious thing.
It is a very serious thing, but that medicine didn't prevent death, and it didn't prevent rebleeding.
So we're deciding not to.
So again, if it's not going to have significant benefit, and there always is potential harm to a medication, then why give it? We will still do all the normal things that you would do for someone with that serious condition in the emergency department, but one of the things we won't do is give them that medication. The surgeon or the specialist may still consider that, but we're not routinely going to do it. Just like in the other cases.
It's not going to be automatic.
It's not going to be an automatic that somebody has Bell's palsy, we do something. Not automatic that we give antibiotics. There are nuances in special situations, but for the standard care, we are not going to usually do that because we want to choose wisely. We want to think before we act in our patient's best interest.
Makes sense. All right, thank you very much, Dr. Milne, for taking the time to explain those things for me. It certainly seems like you have a knack for explaining medical confusing terms to laymen, and we really appreciate you doing those things. It does seem like we have 5 important things that are just examples of how South Huron Hospital is going to be taking patient care seriously and choosing wisely in the future.
Well, it helps to have someone like yourself who's interested in patient education, who wants to reach out to the community like we're doing today. And because we're recording this very close to New Year's, it's almost like we're making a New Year's Eve resolution. So as a medical staff, we are going to make a New Year's Eve resolution that we are going to always choose wisely for the patients that we're serving in the South Huron Hospital. So in the end, just like our flu shot video with this Choose Wisely video, we want to be known as South Huron Hospital is the little hospital that
does
choose wisely.